Lamwo district hosts a new refugee settlement with most of the refugees from South Sudan. District leaders say the influx of refugees continues from the volatile northern neighbor. With the influx of refugees in Lamwo districts, there is need for improved health service delivery. This is the road leading to Lokong refugee camp. We were not allowed to access it, but leaders say the numbers are overwhelming.
Today we have about 41,000 refugees. And these people have come with many health complications, from immunizations, from antenatal care, from name it. And they need services. We visited Padibe Health Centre Four, which is situated in the urban area of Lamwo, and indeed the numbers were overwhelming.
The line is long. You come and have a better view here.
The lines are long and patients have to wait for hours to be served. The Lamwo district leadership is asking government to upgrade Padibe Health Centre Four to a district referral hospital for better funding.
So if it is upgraded, there is a very high chance that we have more doctors. Talk about cases of TB, tuberculosis. Talk about, this is an area that is covering from. We'll talk about HIV/AIDS. Talk about the war that we went through, which also needs surgical treatment, removal of those other injured parts and placing them. And these services, you can only get them either in St. Joseph in Kitku, which is a hospital, or you have to travel to Gulu.
Because of the few congested wards at the facility, management has made rules to have inpatients take shelter under the trees during the day and only return to the wards to sleep in the night.
We have a very high prevalence of tuberculosis, TB, in the settlement. We as workers are at risk of getting many infections, including TB. So as one way of infection prevention and control, we encourage that those who can stay out during daytime, they don't have any risk. If they stay outside, please sit under the tree.
The district chairman says they have been lobbying government for the upgrade for years without success, and they are now losing hope that this dream will be realized.
About 2 months ago, they sent a team to come and make verification whether the infrastructures that we have is adequate to support the health center, the district hospital. Unfortunately, up to now, they have not shared the report with us. We are still looking forward to have this report shared with us. But on our part, we have done what we think is good to have this hospital upgraded. You've seen we have now even TB ward. We are not supposed, under Health Centre Four, we're not supposed to have a TB ward. But with support from the UNHCR, we've been able to build a good ward, a TB ward. We now have administration block. We have the staff houses that have been built with support.
This health center is overwhelmed by many local patients and the rising thousands of South Sudanese refugees, but its drug supplies has remained the same.
These allocations are not determined by the budget you submit. You are given a figure. You get it, to budget against. So sometimes what is brought does not run for the period that is supposed to serve, especially with the influx of the refugees.
Even the human resource is overwhelmed here due to low staffing levels.
But currently we have only one doctor who is battling all this population.
You saw how the other midwife was struggling after working throughout the night. Again, she's on duty right now.
Despite these challenges, the Lamwo district chairman says the staff are doing a good job under the circumstances.
In the national assessment in the health sector, we were number 15 in the entire country.
Uganda is the largest refugee hosting country in Africa, with majority of the refugees from South Sudan and the DRC. Refugee host communities like Lamwo need government and international support as refugee influx puts pressure on local resources. Agnes Nandutu, NTV, Lamwo District.